Hi everyone, welcome to ResearchMD.com. My name is Pramil. I'm a Program Director in Internal Medicine Residency, Transitional Residency, Assistant Professor of Medicine, two large medical schools in the United States, and I'm also Director of Research. We've been doing a series of lectures on endocrinology. We started with all the hormones in a nutshell, one presentation we made, and then we went into the posterior pituitary, and we talked about oxytocin, we talked about ADH, and then we did the abnormality of ADH, that means SIADH, and we also did the diabetes insipidus. Okay, today we're going to hit another big hormone, prolactin, my friend. Okay, so we're going to teach you all about prolactin. Okay, now first thing we have to look at the structure of the prolactin. Okay, it's what? It's a polypeptide hormone, and you got 199 amino acid. We talked about ADH. How many amino acids in ADH? 9 amino acid. Oxytocin? 9. So you got 199. You got a 1 right here. 9. Good numbers. Okay, remember that. 199, 109 amino acid is produced by the pituitary lactotropes. Okay, but sometimes there's some extra pituitary tissues also is produced. They are like mammary gland, brain, gonads, liver, and placenta. Sometimes you can be produced also. That just kind of remember that. Majority is where? Anterior pituitary, okay? Pituitary lactotropes, that's the one you just kind of produce. Remember that. So, and then there is like the 23 kDa molecular weight. That's different molecular weight, about the prolactin, okay? Mainly all of the things we're talking about mainly about 23 kDa. But it's good to know, like some prolactin in the 16 kDa molecular weight have different function like anti-angiogenesis, pro-thrombotic function, and it can cause preeclampsia and peripartum cardiomyopathy. It is involved in it, okay? But that's like a 16 kDa. Everybody got that? Okay, the next we need to know there's unique and negative mode of regulation. What is that? All our, the anterior pituitary hormones and posterior pituitary, there's some kind of stimulus coming from the hypothalamus, right? But in here, there's no stimulus, only inhibition. So what happens? So I'm going to go back over our picture right here. You got dopamine produced by the hypothalamus constantly inhibiting the prolactin release. So prolactin is stay low and under control. Remember that. All the other hormones are what happens in the stimulation, right? You got, okay, just remember, it does not have a stimulating hormone, only inhibition, remember, right? Okay, very, very important. Constant production of dopamine that inhibit the prolactin release and keep the prolactin under control. Okay, what is the next point? Estrogen, main driver of prolactin secretion during pregnancy. So during pregnancy, what happens is like there is increased estrogen stimulate the prolactin, and there is increased prolactin secretion during the pregnancy. Okay, and then what is the next thing we have to know? What are the stimulus for releasing of the prolactin? Of course, it's a lactating hormone. Everybody that the major function. So you need a stimulus. What is the stimulus? And the baby suck on the nipple. Physical activity, stress, light, olfaction. All of this can stimulate the production of prolactin. Remember that, the stimulus. The main thing you have to know about the nipple suckling, because it's a lactating hormone. Remember that. Now we have to come to our main hormone right here. We got hypothalamus and the posterior pituitary and anterior pituitary. We're talking about an anterior pituitary hormone, right? So you got prolactin, and we talk about the hypothalamus secreting dopamine, which inhibit, right? Constant tonic inhibition, if you have to know that. So prolactin is inhibitor right here. Some of the medications, just for injury, nipple stimulation and all that, they can inhibit the dopamine, then the prolactin level can go up. Okay, remember that. So what happens, when you have like hypothyroidism, there is increased TRH production that can produce increased stimulatory effect on the prolactin. Remember that, okay? And then when you have like some higher cortical function also, let's say baby cries, or like and sight of the baby crying, what happens is like this, the dopamine get inhibited and the prolactin level can go up also. Okay, it's very important to know this pathway. And also the last thing, when you have during the pregnancy, estrogen stimulate production of prolactin, and prolactin inhibit the GnRH. When it inhibits GnRH, what happens? You got decreased LH, decreased FSH, okay, and then decrease. Then you can have amenorrhea. That's what happened when the baby During lactation, you can have natural contraception because decrease LH and decrease FSH. Remember that. That part we need to know. Now let's look at our prolactin level in the blood. How do we check prolactin level in the blood? There's two measurements. You can do immunoradiometric assay, IRMA, or you can do chemiluminometric assay, ICMA. Remember, you got like IRMA and ICMA method or immunoassay method, okay? So let's look at the value. In males, it has to be between like 2 to 18, and females like 2 to 30. But what happens during the pregnancy? Go up to really high, 10 to 210. Remember, estrogen, what happens up here? Estrogen stimulates, the prolactin goes up. During the pregnancy, remember, 10 to 210. If it is greater than 200, think about prolactin number, most likely, almost got a definite right there, okay? So low serum levels in hyperthyroidism, and there's like a TRH suppression, right? Here, we'd already said increase TRH, stimulate the production of prolactin, right? So you can lower serum levels, can hyperthyroidism and TRH suppression, you can have it. Okay, remember that is very, very important. Now, let's say the value between around the 30, 40, like 100. Sometimes it could be like a erroneous value. So what you can do in doubtful cases, you take a prolactin level on a different day and you get 2 blood samples 15, 20 minutes apart and analyze it to make sure it is elevated before you do further investigation. A lot of times what happens in the clinic or like somewhere you're practicing, somebody is going to order prolactin and it came back like 50 to 100. You don't know what to do. It's always a good idea to recheck it. Very good. Okay. Now, some medication, the huge effect on this medication, right? You got antipsychotic, antidepressant, opioid, cocaine, antihypertension, GI medication, very common when someone proton pump inhibitor. A lot of people on proton pump inhibitor. What does it do? It all affects this prolactin level. So make sure you stop this medication before you check the prolactin. Otherwise, your value is going to be totally, completely messed up. Okay, when you have a higher prolactin level, always go back and say, did they stop this medication, or it was just kind of like without any medications? Very, very important. Okay, the last point we need to know. Prolactin level can be used to differentiate between seizure and pseudo-seizure, right? You know what pseudo-seizure is? Like what happened, a lot of psychiatric patients, what is the first thing they fake? They fake somebody's having seizure. So in order to differentiate that, you can check a prolactin level, but you have to do between around 20-25 minutes. Usually in the seizure, prolactin level goes up. That may be an examination question. So let's look at the pathway right here. Seizure discharge in the brain, amygdala, hippocampus, and signal go to ventral amygdala, fetal fibers, phonik, subcortical area, and then the signal go to hypothalamus, and then it stimulates the serotonergic fiber into the pituitary, stimulating the production of prolactin. It inhibits the dopaminergic fibers right here, so less dopamine, so end result you can have prolactin, but you have to do this within 20 to 30 minutes, okay? So let's go back and look at it. That's the beauty of like a whiteboard. You can see everything very clearly up here, right? Remember, it's a 199 amino acid. Okay? You got what? Lactotropes, anterior pituitary, and some of the extra pituitary tissues can also produce prolactin. We talked about it. And then 16 kDa prolactin is kind of involved in angiogenesis, and they got a prothrombotic effect. Preeclampsia and peripartum cardiomyopathy can be caused by that. And then you got to always remember tonic inhibition by dopamine, okay? Very, very important. And nipple suckling for lactation. And always remember the dopamine inhibited. That's the main thing we need to know over here. Constantly the producer dopamine inhibit prolactin level. And when you have in the pregnancy, estrogen stimulate prolactin level increase. Then you have, when you have more prolactin, GnRH is inhibited. Then you have decreased LH and FSH. And then we talk about, the prolactin production, increase the milk production is a lactating hormone. And then we talk about the levels, and we talk about the doubtful cases, like what happens, you have to like repeat it different day, and 2 blood samples, and look at, before you order blood tests on prolactin, make sure your patients are not on any of this medication. You may want to stop it. And the last point is the examination question. Prolactin level can be checked to differentiate between pseudo-seizure and seizure. There's a pathway is given right here. Thank you so much for watching today. We'll be back with another presentation. If you could subscribe to our channel, we would greatly appreciate it. God bless you all. Study hard.